fireside chat with some of my surgical buddies. We'll be here to talk about surgery. You cannot see the comments that are coming up.
Okay.
So you're going to have to be my eyes hello to.
You should say hello to Brianna.
Hi, Brianna. How are you?
Should say hello to Marie.
Hello, Marie.
Someone said, hey, doctor.
Hey, what's up?
Hello. Some heart eye emojis.
Oh, my God. All right, so let's start with Dr. Deal.
Well, hello world. How are y'all? I assume some people on the East Coast are just now able to get off work. Hope everyone another safe day out there. Some crazy news today.
Oh yeah.
Out there, some good friends we're worried about overseas. But hope everyone's had a safe, good day today. So, but we were pleasured enough to have Dr. Miami come all the way up here and visit our practice. It means a lot to us what we built here. Very big investment for what we love, and to be able to build the first center of excellence in plastic surgery body contouring. For those of you who don't know what that means, is we took it beyond just all the accreditation standards like HHC and having the hospital privileges, the board certifications, which are so important, but making sure that our complication rates were so exceedingly low and that we could treat all conditions, face, body, inside and out. It was a tough designation to get, and to be able to do that in our humble small town of Chattanooga, Tennessee, all the big, wonderful institutions and good friends that we have in all the big cities, Miami, Chicago, New York, LA, Vegas, all our good colleague friends out there, we're very proud. So to have him come up and visit our center and be able to see what it was all about really means the world to us.
It's super impressive. I don't know if you guys have been watching my Snapchat today. I've been touring the facility. It's really top of the line, and I've been all over the world, from Beverly Hills to Dubai. This center is really a center of excellence. Really, it's top of the line. Nothing in New York or LA can beat this here in Chattanooga, Tennessee, which, you know, who knew? Who knew? I had to come see it myself, you know, to believe it. If you guys have plastic surgery questions, we've got four, and me, I guess 4.5 very experienced doctors that you can ask your questions to, and we're happy to answer live for the next 15 minutes. Any plastic surgery questions, go for it. Megan, you'll have to read them to us.
Someone said, can you advise if you need to replace breast implants after 10 years?
Well, I'll give you my opinion. I think if they look good and feel good, just leave them alone. What do you guys think?
Absolutely, completely agree. Completely agree.
Yeah, last I checked, there's no expiration date. They don't. You don't have to.
They're not like tires. You don't have to, rotate them after 100,000 miles or replace them.
Yeah, and don't fall for the trick where the surgeon tells you got to replace them every 7 years. All that is job security. Implants last. I've seen them last 25 years.
I've seen them last longer.
And that 10 years, that's usually the backward warranty. Again, if there's nothing wrong with them, you don't have to do anything.
Early. Yeah. She looked beautiful, by the way.
Yeah.
75, had breasts like a 16-year-old.
Yeah.
Okay. Someone said, how much do you need to weigh to get a BBL done?
Depends where.
Yeah, so this is a question that we get a lot. And in fact, we talk about this all the time. Truth in advertising. You get so excited, you see these beautiful results, you get fired up, and of course we could show ours and get you so excited, but you call and find out, oh, BMI 30 or above, we don't do those surgeries. And I understand that can be reasonable, but at the same time, if you have a facility like this we built, essentially it's like a cosmetic surgery hospital, we feel that we can do that very safely. So we can do surgeries up to BMIs of 35. And we still have solutions for patients after that. If you need to get the weight down, we even have a balloon. Dr. Gushing, this is one of his expertises, and he puts this balloon in and you lose the weight. Our Hormone Wellness Center, we get people to lose the weight, and then we're able to do the surgeries for them. And also, if you look at the advertised cost, they typically are starting with a very low BMI maybe 21, 22. So when the typical average, when we talked about this earlier, what the average BMI of a woman in the United States of America, okay, 30. So when someone's beating himself up, say, well, my BMI is 30. That's actually normal. And unfortunately, that means you don't qualify for a lot of plastic surgery. We will do it here, and we'll do a great job for you. And most importantly, we're going to do it safely. Why don't you tell them a little bit about this balloon?
Yeah, so this is a Ribera balloon. It's non-surgical. We put you to sleep, either general anesthesia or just sedation. Go down your throat with a scope, look in the stomach, make sure everything looks good, and I put a balloon in there. Fill it up with about 550 cc's of saline. You leave it in for about 6 months.
Balloon?
It's a big balloon. It's a big balloon. It takes up a fair amount of the stomach. And people are losing anywhere from 20 to 70 pounds per week, depending on how motivated you are. And then at 6 months, we go back in, drain it, pull the balloon out, no incisions, no issues at all. You talk about like sleeve or all these roux white, side passes, you worry about all the scar tissue and, things are all rearranged. Well, this is simple. Balloon in, balloon out, you're good to go. So it's definitely a really nice procedure.
If you filled the balloon with helium, would you weigh less?
I think you're correct, actually. So think about that. And if it bursts, you start talking.
Unless you-
And then if you,
There we go.
Oh, that's cool.
There it is.
Oh,
The ovarian balloon.
That's cool.
So it makes you feel full, right? You eat and this area gets filled up, you feel full, and you feel full longer because it takes a long time for the food to get around there. So that's how that works.
Wow. That's pretty
Gotta
cool.
love it.
Oh yeah, and it
What a
works.
time to be alive.
And some of the cool things about the expertise that we have here, a lot of people have varicose vein issues, and we treat that. When people say, well, where do I need to go for my hair transplantation? We do that too, and not just the old school strips, the singular follicular, and we have an expert in that as well. We really try to go top to bottom with this to be able to treat any of these conditions. So if you have questions about the varicose veins, and that's actually one that's covered with insurance, which is very nice, okay?
Insurance pays for varicose veins?
They do.
Oh, that's good.
They do. Now, there's little spider veins that are on the top. That's considered more cosmetic, and there's treatments for that make them go away immediately. And then you have to kind of keep up with the treatments, but it's pretty impressive to do that. And then this is a big one that I don't see a lot. A lot of people, a lot of your family that loves you on that Instagram family, they see a lot of body work. You don't see as much face work out there, and the problem is people don't want the scars, right?
Right.
It was important to our practice. I've been good friends with Dr. Kluska, gosh, for many years now, at least a decade. And his work, face and body, unbelievable. In fact, he's the former president of the American Academy of Cosmetic Surgery. And we wanted to always not just have the best equipment, but have the best providers. So it meant the world to me that I was able to recruit him here to Southern Surgical Arts. And he has some photos that are phenomenal. Finally, Scarless facelift exists. I'm talking really impressive facelift results where there's no scar. He can show you so many photos. For those of you out there who say, well, I'll never consider it because I don't want the scar, he can do it now. So he can tell you all about that, the technology involved. Really, we should actually have I'll see if I can pull up some photos while you're talking. Yeah.
There's the man.
Well, we have, what I've done is created this, it's scarless in the fact that you don't see a scar, but Dr. Miami came up with a great term called invisible scars. So it's nice because you can have
Invisible
this nice
facelift.
invisible facelift. You can have this nice little facelift with just a tiny little scar behind your ear.
Incredible.
We use all of the current technology. Guys, we have more lights and lasers and heating devices in this facility than probably any facility in the country collectively. I can guarantee that.
They literally do miracles here, and let me show you what I mean.
Don't burn yourself.
Miracle workers. Southern Surgical Arts. Miracle workers. Miracles happen here daily. Ah! Kidding. Fine.
Okay. Someone said, how long usually is recovery for most surgery?
Depends what surgery. Like what surgery are you talking about?
Mm-hmm.
Breast aug is
breast
like,
augmentation.
Yeah, like a week max. BBL could take 2 or 3. Total mommy makeover, breast lift implants, tummy tuck, BBL could take 3 or 4. Depending on what your lifestyle is like. If you're just sitting around eating bonbons, you go back to doing that in a day.
Someone
But
said,
if you got lots of kids running around, then you need a couple weeks to get ready to get better.
okay, is it possible to lift breasts while maintaining the same large cup size?
Yes, it is. But you would probably need implants. Because when you do a breast lift, you also make the breast smaller. And to replace that volume that you lose, you have to put an implant in.
One of the things on the breast lift thing that I always tell the patient is that you got to think about this as a tube sock. If you roll it up and put it into a bra, it fits the cup size. But when we hem it or do a mastopexy or a breast lift, you lose that volume. That's why an implant is so important.
Right. I like that analogy. It's got the tube sock rolled up.
In the console.
Oh, okay.
So,
Oh yeah, you want to put the link there?
Yeah.
Yeah, put the link there.
Okay.
Put the link there, and then also maybe we'll go live with some people and answer some questions.
Yeah.
Before we go check out the brow. I learned a
Okay.
new word today.
Brow.
Brow. The brow of the mountain.
Someone said, what made you guys become surgeon, and what is it like to have your own practice?
Oh man, I was probably 17 years old. So I grew up, I'm military. My family, mom, dad, grew up all over the country, and I'm probably the only one that didn't serve in my family, brothers included. And but my mom got into it was one time life,
You're
single mom.
serving mankind.
That's right, I'm serving
Hero.
mankind.
What's
But,
the link?
you know, she got into medicine, and I grew up in a hospital system as well as being in the military, and I was more fascinated with the surgery. And there's all sorts of fields that I really loved, parts of neurosurgery I love, parts of orthopedic surgery I love, but I really fell in love with the aesthetic part of things. And when you say plastic surgery, there's so much more involved. Burn, recon, craniofacial abnormalities, hand surgery. It's really, plastic surgery really is general surgery. I mean, it's like one of the true last general surgical fields. But the aesthetics is its own animal, and I really loved the art part of that. And at 17, you know, I had, this is a totally true story. I said, I'm either going to go for what I really want to do in life, if it was just going to be fun, and I didn't want to have to worry about a career, and that was going to be ski patrol. Because I love to ski, and I love the medicine, so I thought I'd be ski patrol and maybe take care of people on the mountain. And outside of that, it was going to be, you know, if I go to medical school and I'm doing well and I really love it, then I'm going to go for being, being aesthetics, being a cosmetic surgeon.
So it's either ski bum or high-powered plastic surgery.
It was one or the other, and I say people, gosh, unfortunately, I was good. I was good in school.
You chose well. I think you chose well.
So that's what ended up happening.
Yeah, that ski bum thing doesn't look good as you get older. You know what I mean? It becomes, it doesn't age well.
Bad knees.
The bad knees.
Bad knees.
Okay.
I wanted to be Paw Patrol.
Yeah, I hear you.
All right.
I did not want to be ski patrol. I've been skiing a couple of times. It's fun, but no, not for me. You know, I was always a science guy, interested in, did well in science, and knew I wanted to do something where I worked with my hands. I did bariatric surgery and general surgery for about 7 years before I got into cosmetics, and I do really enjoy the artistic aspect of it. And it's just rewarding to take somebody who's like a gastric bypass patient who's lost all this weight and they're trapped in the skin. And it's so rewarding to be able to remove that skin and just improve their quality of life and have their new self-image fit how they feel inside to help. So yeah, that's why I love it.
And then,
Well, I'm an instant gratification type of guy, and when you go into medicine, you have to be either a mental gratification person or a physical, and I'm a physical guy. I have an art degree from college, followed my passion in art all the way through medical school, general surgery, plastic surgery. Love the field. It's very rewarding. It's a field that gives back to you and gives me instant satisfaction, and it gives the patient instant satisfaction too.
What do you think of that sculptor guy out there in the front? What's his name?
Richard McDonald.
Richard McDonald. What do you
Yeah,
think?
awesome.
Good guy?
Yeah, awesome.
Talented?
Yeah.
You're better though, right?
Yeah.
You're better.
Yeah, I'm a little better.
okay.
He said he was the best. He said McDonald was the best in the world, but I think you're best. Art is in the eye of the beholder.
All right. Dr. Cushing.
Well, I'm a little different. I actually went to Ohio State. You have to go figure it.
I'm a little
different
We
here.
didn't notice that.
In case you didn't notice.
You know, the motorcycle and the scrubs, you know, we didn't notice.
And the boots, and the
the
boots.
cowboy boots.
Boots.
The balloons in the belly.
I'm a weird guy, right? But I actually went to Ohio State and did architecture for 2 years.
What?
Yeah.
Architecture?
Architecture. Before I went to school, it was like design or medicine, and it was like they're not even close to being related. But I chose design, did architecture 2 years, decided I didn't like it, switched over to medicine. You know, the medicine field, and you know, haven't looked back since, and I'm very glad I did it. So I'm also a hands guy. I mean, I'll be working on motorcycles, cars, building things, remodeling things. If you watch any of my Instagram videos, so surgery is like perfect for me.
Awesome.
Yeah, I did want to showcase this for a second because, again, I don't see a lot of, because I'm going to brag a little bit on Dr. Kluska's work. You would see photos like this, and you would think that this patient had a facelift, okay? And they did. What they had was the specialty technology, what I call Scarless. I guess officially there is a tiny one behind the ear called the invisible facelift, but this patient does not have that downtime of 6 weeks typical. I mean, maybe they look a little swollen for up to a week or so, and you're going to get results like this. I could show even more. I mean, look.
This patient did not have a facelift.
This is incredible. The technology now exists in 2020. And you know, the problem is when you're 40, when you hit 40, you start to finally say, oh my gosh, I'm kind of looking like my mom did. You hear that? And it frustrates people because they still look young enough. You don't want the scars. So at 40, you don't do anything about it besides the. But now we can actually give people some pretty incredible results like this without having to have the big surgery. So Very, very impressive, and I really wanted to brag on him, and I'm so glad we have that technology and the talent here to finally be able to offer something like that. I like the pink phone. And the pink phone, yes.
Is that a light on your glasses there?
Yeah.
Can I see it?
Well, I don't have the light on, but yeah, it's just a little
LED?
Little magnet that goes on with a little battery. LED, yeah.
Oh, neat.
Yeah, really, really cool.
Wow.
Yeah. You know what?
How much?
Well, I don't know.
$100?
No. We got these from the company.
Oh.
Well,
Is it you?
Innova, we have a great relationship with. I mean, we love their headlights so much. Their LED headlights, I think we purchased maybe 8 of them.
Right.
And when they were just coming out with that technology, they, after
They
this
gave
relationship,
it-
they actually gave them to.
Yeah.
Well,
Cool.
the thing is, he's so famous.
Yeah.
They just gave them to
They
him
wanted him
for
to
free,
be in
right?
so it's like
But
that.
it
Yeah, I'm
helps. Yeah.
It's like for promo, your sponsor.
It's my sponsor.
Like,
They're my sponsor.
like a surfer, you know, or a skateboarder.
Yeah, that's right. We get shoes
that's
and
right.
lights.
Right, shoes and lights. Good for you. He has a big market for lights or headlights. Very good. I'd like to do if we can do a split screen live. Maybe we'll flip the camera around and we'll ask somebody to come on live and see what they. Cool.
Yep.
Let's see. All right. Oh. Hello. We'll choose you. Fine. We'll choose you. God's flower. Go live. We can do some live. Some live with the doctors.
Hi.
Hi. How are you?
Hi. So I'm 48 and I don't like this.
So am I. I'm also 48.
Oh, really? Yeah, I'm turning 48 January. So I want a mini facelift, nothing like my cane. So I don't like this indentation.
You're talking to the man right there, Dr. Kluska. Go ahead. What do you think?
Well, in looking at you real quickly, you probably don't need much, and the best thing we could probably offer you would be a little bit of fat grafting. How's your neck? Is your neck okay?
I don't like this little.
Yeah,
I see that.
you're perfect for my Scarless or invisible facelift. Perfect. Little incision behind the ear, one under the chin. Heat this skin and soft tissue underneath. Liposuction. We'll do the jowls. Lift this up. Do some fat grafting, and then I would top it off with Morpheus, which heats microneedles and heats the skin. You can't beat it.
How can I get it? How can I start? I want to start. I want to pay now.
You want to pay now? I love it. Well, what you have to do, go on Instagram under Dr. Daddy K and message me your name and phone number. My staff will reach out to you here in a few minutes.
Like Daddy, DADDYK.
No, just
DRDADDYK. Dr. Daddy K.
Oh, Dr.
Daddy.
Okay, K as in Karen. My name is Karen.
Yes,
Hi,
K as
Karen.
in Karen. Right.
Hi, doctor. All right,
I think
thank
that's a sign.
you. Yes, I know. Dr. Miami, you the best. I love you so much. I had a dream about it
Just message me real quick and we'll get on it.
right now. Thank you.
Yep. Bye-bye.
Bye.
Isn't that fun? That's super fun. Isn't that fun?
I love it.
All right, let's see. Okay, Dr. Daddy K. Somebody just wrote that. All right, Dr. Daddy. They're all putting Daddy. Oh, your daughter, maybe, K.
That's my daughter's.
Yeah, she said Daddy. Somebody wrote, son got them calling him Daddy. Now they're all calling you Daddy K. Pick me. Okay, we'll pick you. Hold on. Wait a minute. I tried to pick you. It won't let me pick you. All right, let's see. A whole bunch of people want to go live. Let's grab somebody. Who wants to go live? Find somebody to go live. Live.
Hi, Dr. Miami.
Hi, how are you?
Good. How are you?
What's new?
I'm sorry?
What's new?
Nothing. Just working from home.
Oh, all of us, yeah.
Mm-hmm.
Where
Not
are
very
you?
fun.
Where are you?
California.
How's it going over there? How's the COVID?
Horrible.
Oh, yeah, pretty
Where I live, it's like the hot spot right here.
yeah, pretty bad in Miami too. Well, so what kind of work do you do?
I do office work.
Okay,
I'm an office assistant.
cool.
Yep.
How can we help you? What plastic surgery questions do you have?
Just like on the mommy makeover and the BBL
Okay,
is something that I've been like looking into.
okay.
And I've seen that they have like recovery homes and all that. And I was just wondering, like, is that no?
No.
Okay, I thought that was like a no.
No. What I meant to say is, first of all, I want to ask some questions. Are you done having kids?
Yes, I have 3.
3, you're done. Okay.
Mm-hmm.
Yeah, that's a good idea for my makeover. So in Miami, my patients stay at a hotel that's like half a block away. I've got like a suite of rooms and nurses that watch you. So I don't use like a recovery home per se. I have my own, setup.
Okay.
Southern Surgical Arts, they have 3 hotels within.
we have relationships with.
Yeah.
And then also some Airbnbs. You got to be. These recovery suites are basically like hotel affiliations. You can create one of your own. But for those of us who we have a lot of both international and national patients, like Dr. Miami and here. We have those setups for people, so we try to make it very seamless. We even help everyone with the travel accommodations, show them the best flights, cars. We really try to make it turnkey, so the experience is pretty easy. In fact, if someone doesn't have a caregiver that can come with them, we can even provide a nurse that can take care of you with the first. For the first 48 hours, you want to have someone that can care for you. Okay,
Yeah.
So if you don't have somebody, yeah, absolutely.
Leave the kids at home. Whatever you end up having surgery, leave the kids at home. They're not going to help.
No,
No, leave them at home and you just have mommy time. Give yourself a good 7 to 10 days alone to recover before you go back home.
Okay, and then what is the price range usually on those? For like, is that a BBL different than a mommy makeover?
Or
is that the same?
Makeover is any kind of surgery that involves like reversing the signs of pregnancy and childbirth. So a tummy tuck, with or without breast lift, with or without implants, with a BBL, so they're all combination procedures. So a BBL can run you anywhere, depending on where you go and what you do, between $7,000 and $15,000. And then but there's combination packages that make it cheaper. So you do tummy tuck and a BBL together, it might be $15,000. Tummy tuck, BBL, breast lift with implants might be $25,000. Depends, who your doctor is, where you go, and whatever. But the price range is somewhere along those lines. Bear in mind that if you're going to travel for it, you have to budget for the hotel or for the caretaker and things like that. What's your time frame? When are you thinking about doing something like this?
Whenever.
Whenever you got.
Yeah. Right now is like probably the perfect time since we're all on lockdown.
All right, cool. Let me ask Dr. Deal, what's your price? What do you think you need? Just a BBL, or you want a BBL and a tummy tuck?
I don't know if I need a tummy tuck. I have like that mom, like that little mom, like pooch. So I don't know
is there skin there? Is there extra skin?
A little bit, yeah.
Go, show me the skin, if you don't mind.
On here?
Yes,
just
everybody? No, it's just me, you, and about 400 people. It's
okay.
Yeah, probably a tummy tuck. Yeah, you do.
You're like, yeah.
No, because it's not the pouch so much. It's the skin, the stretch marks. It's all stretched out. So if you just do liposuction there, that skin's just going to kind of hang. It's not going to be. It's not going to snap back. What will be? So you want a tummy tuck and a BBL probably?
Yeah.
Yeah. All right. So let me give it to Dr. Deal. Here we go.
Dr. Carter's got the list here.
So we have everything lined up for you. We have it all listed out. Basically, if you're looking at core lipo 360.
A tummy tuck and a BBL.
Okay, tummy tuck and BBL is what she wants.
Yeah, so the deal is we're going to do that as an add-on for BBL. So here's what we do. We try to have the most transparent pricing in the world. And here, when you see an advertised price, this is key because we've been dealing with this all day. A lot of people have been excited.
Mm-hmm.
First of all, many times a BMI 30 or above, they won't even do your surgery, which is understandable in some cases.
She's skinny.
Okay? So you're going to be okay, BMI less than 30. But then you see a price online, many times they're pricing it only with a BMI of starting with like 20, 21.
Oh, okay. Yeah.
So you see some price that looks so good, $10,000. Then all of a sudden you say, oh, my BMI. We had a staff member call a bunch of different places to find out what people were charging because we knew our prices were so good. She called and said the advertised price was $12,500. She said her BMI was 26. Then they gave her a quote for $17,500 because of her BMI. Okay. 26 is not that high. So if anyone's curious about what your real price is, go online, find out, type in BMI calculator, and any place. And here's the key to know the truth: are they including OR? Are they including anesthesia? Are you getting your BMI? And they're telling me. And is it all the aftercare involved?
Yeah, that's what I want to look for. Is the recovery.
Yes, and then if you ever need a little touch-up, say the scar's a little wide here, a little tiny lipo here, most places will charge you another many, many thousands of dollars.
Okay.
And here we do it for $950 per hour. Literally
Okay.
just cost to cover the anesthesia. So when we try to show people our prices, we say we really do beat, because we're truthful in our advertising. We're in Chattanooga, Tennessee. Our cost of living and what we pay, because we're a larger practice, what we pay for our cost of goods, way lower. Just to give you one example, because we can give you an individualized consult based on your BMI, and I don't want to call your BMI out, live amongst other people.
I don't even know it.
Happy to do this otherwise. You put in your height and weight, okay? But give you an example. Gummy bear implants, if you go on Google, anyone here listening to this live, go on Google and type in average cost of gummy bear implants. You will see that it's shockingly $9,000, okay? Once they really give you the price and they include OR and anesthesia. Our price, $5,650. That just gives you an idea. So we have a ton of California patients who fly all the way here simply for a gummy bear augmentation, because we're including OR, we're including anesthesia, and even if you need a tiny touch up in your implant, $950.
Yeah, that's really good.
No one is doing that. And so similar pricing for the lipo, tummy tuck, BBL. Think, oh no, I got such a great price. This one doctor quoted me $10,000, or they saw that. But when they actually called, and then they got a bill from OR, and then they got a bill from anesthesia, and they got another $4,000 bill to touch up the scar. Next thing you know, they spent $30,000 plus, and here it would have been $15,000, $16,000, $17,000. They realized they would have saved. Usually, our patients save anywhere between $3,000 to $15,000, depending on the size of it.
Yeah.
And you don't know it because we actually list the real price. Some people think, oh, they're more expensive. No, it's because we're being honest.
Yeah. See, I wouldn't have known that at all about the extra
Mo-
add-ons and all that stuff.
Don't. There's such that the big thing is to get you to call and do the consult.
Yeah.
Because they advertise a price that's so low based on a BMI of a supermodel.
Yeah.
Normal woman's BMI. And then in many cases, the average woman BMI is 30. And if most surgeons don't even do 30 or above, that means the average patient doesn't even qualify for surgery. How crazy?
Yeah.
Okay, look it up online. The average BMI of a woman in the United States is 30. Okay, so that's what we try we want to reach out. This is why we're so glad. We've known Dr. Miami for years and his success, and he's such a great surgeon, always do, but we don't have the audience that he has to reach out.
Yeah.
Trying to get that message out to people. Not only are we offering prices that make people fly in, but at the same time, we're doing it in the first center of excellence. People would have thought the first center of excellence of plastic surgery body contouring, they would have thought it would have been in New York or LA or Vegas.
Yeah.
We did it right here in Chattanooga. Again, we ask everyone to confirm what we're saying. Go look it up. Go look it up. Go look up center of excellence, which one's the first. Go look up the average cost and all this. And look up, like if you go to the American Society of Plastic Surgery website, the prices they're giving you are only the surgeon's fees. They're not including operating room and ambulance.
Yeah.
Okay? You got to get the real price top to bottom, and then you'll see, wow, that actually is the most affordable prices without making compromises. In fact, we laugh. One last thing I'll say, I want to take the phone because this is such a passionate thing for me, being truthful in advertising. For the price people pay to go down to Mexico to have their surgery, plus the flight, plus this hotel stay, they could have stayed in the United States and had it done by board-certified cosmetic and plastic surgeons, okay, and paid the same or less, not going to
That's
Mexico.
Good to know, because I've been looking into something similar to that.
I want to get that word out. I really want to get that word out.
Yeah.
All right.
Well, thank you.
You're very welcome. I hope you do. I hope you do have a great surgery and a great recovery.
Thank you.
Be well. Just stay
Thanks.
safe. Bye bye.
Bye bye.
All right. Thank you, everybody. You guys have a great night. Stay safe. Keep positive.